In this particular case, we're going to be looking at the in and opposed phase images. This bottom image here is our in phase image, and the top image here is our opposed phase image. Now, when we're looking at in and opposed phase image, we're typically looking for fat deposition. And the way that you see fat deposition is usually lower signal within the opposed phase image as opposed to the in phase image. And you can see here in the bone marrow here on the in phase image, you can see that on the opposed phase image there's dropout of signal here. And so that represents fatty deposition. But sometimes you can see the reverse occur where things look darker on the in phase as opposed to the opposed phase. And so here you can actually see the liver here is actually quite a bit darker than in the opposed phase image. Same thing tends to occur with bile gas, but the reason that we see it within the liver here is because of iron deposition within the liver. This patient also, if we scroll down here and we take a look at the pancreas, we can see that the pancreatic parenchyma here also has lower signal on the in phase image as opposed phase image, and so there's iron deposition within the pancreas. And so this is a patient who actually has primary or hereditary hemachromatosis, which is caused by increased intestinal iron absorption. The increased iron deposits in parenchymal organs such as the liver, the pancreas, the heart, and the pituitary. And that's to be distinguished from secondary hemachromatosis, which is usually from taking a lot of iron or infusion of blood products, in which you typically see the liver and the spleen having decreased signal on the in-phase image. The pancreas is usually spared. And so the way that I think about it is P is primary, but is also pancreas. And so here you can see the pancreas involved. S is secondary, and the S for spleen is also involved. So those are, this is a nice example here of primary hemochromatosis that you can see with the iron deposition within the liver and the pancreas.